Hi, I'm a rheumatologist. And today we are going to talk about lupus. I know many of you have been requesting us to make a video about lupus for quite some time now. So today we will be talking about what is lupus, who gets it, why they get it, what are the symptoms, what are the warning signs, how we diagnose it, how we treat it, and much more. So please stay tuned till the end. Let's start by answering the question, what is lupus? Lupus is an autoimmune disease. In an autoimmune disease, your immune system mistakenly attacks your own tissues. Now, normally our immune system protects us from outside invaders like bacteria, viruses, and even parasites. It does this with the help of special proteins called antibodies. Antibodies are proteins that identify and neutralize harmful foreign bodies in our body and tag them for destruction. These antibodies are produced by special white blood cells called B cells. Now, in normal, healthy individuals, these antibodies specifically target foreign invaders and do not attack our own cells. But in people with autoimmune diseases like lupus, these antibodies turn rogue and begin attacking our own tissues and organs. This can lead to inflammation and even damage to these tissues and organs. Now, while the exact cause of this mistake by the immune system is not completely understood, we believe that both genetics and environment play a role in this process. Many people with lupus have a family history of other autoimmune disorders. Also, environmental factors like sunlight and certain medications can trigger or worsen the symptoms of lupus. Let's now look at who gets lupus. Now, lupus can affect anyone regardless of race or gender. However, it is more common in women than men. In fact, 90% of cases of lupus are women. We don't really know why so many more women get lupus than men. One theory is that hormones may play a role, since lupus symptoms often flare up during pregnancy or after giving birth when hormones are fluctuating. Also, people of color are at higher risk of developing lupus. African Americans, Hispanics, and Asians are at 2 to 3 times greater risk of developing lupus than Caucasians. What are the symptoms of lupus? The symptoms of lupus can vary widely from person to person. Some people may experience mild symptoms that come and go. Others may have more severe symptoms that last longer and may even require ongoing treatment. Common symptoms of lupus include extreme fatigue, joint pain, stiffness, and swelling, especially in the hands, wrists, and elbows. Most commonly affected joints are the ones closest to the center of the body, like the joints of the hands, the elbows, the shoulders, the knees, and the ankles. Redness or rash across the nose and cheeks, very sensitive to sunlight, chest pain, fever, weight loss, and hair loss. In addition, lupus can also affect other organs like the kidneys, the heart, the lungs, the blood vessels, the brain, the nervous system, the skin, the gastrointestinal tract, and even the eyes. Kidney involvement is one of the most serious complications of lupus. Symptoms of kidney involvement include changes in urination, foamy or bloody urine, swelling of the feet, ankles, and lower legs. If left untreated, it can lead to kidney failure. Other serious complications include blood clotting abnormalities, which can increase the risk of stroke and heart attack, and pericarditis or inflammation of the sac around the heart. Next, let's look at the warning signs of lupus. There is no one specific warning sign that indicates you have lupus. Instead, it's a combination of symptoms that point towards a possible diagnosis of lupus. Some of the most common warning signs of lupus include extreme fatigue, unexplained fever, joint pain, and swelling, particularly in the morning or after periods of rest. Photosensitivity, or rashes that appear or worsen when exposed to sunlight, hair loss, chest pain, and mouth or nose ulcers. How do we diagnose lupus? There is no one test to diagnose lupus. Instead, we use a combination of tests to rule out other conditions and to identify patterns consistent with lupus. A physical examination and a review of your symptoms and medical history is an essential first step. We will ask questions about your symptoms and how long you have had them, as well as your family and personal medical history. For example, we would want to know if you have a history of autoimmune disorders in your family, if you have been sick recently, or if you have traveled anywhere where you might have been exposed to different infections. We will also ask about any medications you are taking, including over-the-counter drugs and herbal supplements. Certain medications, such as hydralazine and procainamide, have been known to trigger lupus. Also, we will perform a physical examination to check for signs and symptoms of lupus, such as rashes, joint swelling, and any other physical abnormalities. We will also order blood tests to help with the diagnosis. One of the most common blood tests ordered is a complete blood count, or CBC. This test measures the number of red blood cells, white blood cells, and platelets in your blood. People with lupus may have low levels of these cells, which can indicate anemia or bleeding. Another blood test that may be done is the anti-nuclear antibody test, or the ANA test. About 95% of patients with lupus have positive ANA test results. The test is highly sensitive, but not specific for lupus. That is, although most people with lupus will have a positive test. People with other autoimmune disorders such as scleroderma, rheumatoid arthritis, and Sjögren's syndrome may also have positive test results. Another blood test that may be done is the anti-double-stranded DNA test. If your ANA test is positive, then your doctor may order the anti-double-stranded DNA test. About 20% of patients with lupus have positive anti-double-stranded DNA test results. Positive test is strongly suggestive of lupus. In some cases, your doctor may also order other blood tests to rule out other conditions that may mimic lupus, such as rheumatoid factor, to rule out rheumatoid arthritis, or C-reactive protein and erythrocyte sedimentation rate to assess for inflammation. Your doctor may also order a 24-hour urine analysis to check for signs of kidney involvement. Once a diagnosis of lupus has been established, your doctor may order additional tests to assess for involvement of other organ systems, such as an electrocardiogram to assess for heart, involvement, a chest X-ray to assess for lung involvement, or an MRI to assess for brain involvement. Now let's look at how we treat lupus. Since there is no cure for lupus, the goals of treatment are to relieve symptoms, reduce disease activity, prevent organ damage, and improve quality of life. Treatment often involves a combination of rest, medications, and lifestyle changes. Medications used to treat lupus include antimalarials, nonsteroidal anti-inflammatory drugs or NSAIDs, corticosteroids, and immunosuppressants. Antimalarials such as hydroxychloroquine are often the first line of treatment for mild cases of lupus. They help reduce joint pain, swelling, and skin rashes. NSAIDs such as ibuprofen or naproxen can also help relieve joint pain and inflammation. Corticosteroids such as prednisone are powerful anti-inflammatory drugs that can be effective in treating severe cases of lupus. However, they have significant side effects and are typically used in the short term. Immunosuppressants, such as methotrexate or mycophenolate, Mofetil, are also used to treat severe cases of lupus. They work by suppressing the immune system and reducing inflammation. Biologics such as belimumab are a newer class of drugs used in the treatment of lupus. Belimumab is a monoclonal antibody that targets and depletes certain white blood cells, called B cells. By doing this, it helps reduce inflammation and decrease disease activity. Apart from medications, your doctor may also recommend lifestyle changes, such as getting regular exercise, eating a healthy diet, and avoiding alcohol to help manage your symptoms and improve your overall health. So let's wrap this video up. Lupus is a complex and challenging disease, but with the right treatment and self-care, you can manage your symptoms and live a full and active life. As always, consult with your doctor for any medical concerns. We hope this video was helpful and informative. Please share it with anyone you feel will benefit, and like and subscribe to our channel to stay updated on all our future videos.